This video is about the top remedies for a UTI updated. I had an older video on this topic, but I wanted to update it with some new information. A UTI stands for urinary tract infection, and this can be in the lower part as in a bladder infection, or the upper part, which could be more of a kidney infection. Now, the most common pathogen that's involved with these UTIs is E. coli. Now, normally in our bodies, E. coli is not harmful, okay? It's neutral. It lives in our body and it doesn't create any problem. So what would make this E. coli unfriendly? And the answer to that would be the environment, okay, that it lives in. So let's go through the different things that can change the environment for this microbe. And there's other microbes too, mainly bacteria, that can turn more pathogenic and create this problem. Number one, having high glucose. So if you're diabetic, you're at a higher risk than someone that doesn't have diabetes because all this sugar changes the environment and it feeds a lot of the pathogens, especially funguses, yeast, and candida, okay, which can also create a UTI. So based on that, you'd want to definitely cut out the sugar if you have a UTI. Next point is high estrogen, okay? Now this can occur when someone's pregnant or they're ovulating. There's a higher chance of getting a UTI during ovulation and when you're pregnant because of this estrogen, okay? So there's definitely a shift of estrogen that can affect your immune system and also going the other way too, because if your estrogen is lower, okay, that can alter the barrier, the vaginal flora, the good bacteria that's supposed to protect you. And this is why women that are postmenopausal have a higher risk of getting UTIs as well. So estrogen too high or too low can be a problem. Now, the other thing is antibiotics, especially quinine. Antibiotics kill off not just the good, but the bad, and then these pathogenic bacteria get pissed off and then they start to create problems and inflammation and infection. And also funguses and candida, because antibiotics don't kill the fungus and the yeast, so they live. You just kill out all the bacteria. So now we have this overgrowth. It can create a situation, and especially if you have to take frequent antibiotics and you develop this resistance to antibiotics and then they don't work anymore. And now you have UTIs very, very often. So it's not the best long-term solution. Now, intercourse can also be a problem with cross-contamination. And then catheters can also increase your risk of getting a UTI. So let me just tell you some really good remedies that you can use for a UTI. So the first remedy is called buku. This is probably one of the best things you can take for a UTI. It's stood the test of time. It's been around for a very, very long time. It's highly antimicrobial. It's anti-adhesive. In other words, it prevents the bacteria from attaching. It's been shown to decrease the risk of getting an infection in the bladder, and the prostate, and the urethra. And on top of that, it's a natural diuretic. Okay, next one is cranberry. This one is also anti-adhesive, and it prevents the bacteria from accumulating on the inside of the bladder and the other ducts. And it can also inhibit biofilms, which tend to accumulate in the bladder and the kidney and the connections. Then you have Uva Ursi, which can act as a natural diuretic. And the next one is juniper, which is a great antimicrobial for the bladder as well as the kidney. And the last two things, which are not herbal remedies, but they're highly recommended. Number one, doing fasting. Fasting is probably one of the most potent things to help your immune system really fast. Just stop eating for a while, maybe a whole day, maybe 2 days, and you will probably see great improvements in your immune system. And then also, like I just mentioned previously, cut out the carbs. Go on a low sugar diet because that's what feeds these pathogens. So we want to starve them off, especially if it's a yeast infection, a candida infection, or a fungal infection. All right, thanks for watching.
I'd like to share with you one of the best remedies for a UTI, a urinary tract infection. Let's first cover the symptoms: burning upon urination, frequent urination, the urge to urinate when your bladder is empty, and also you might have abdominal pain, which is a little lower in your abdomen, lower back pain, blood in the urine, cloudy urine, or your urine has a bad odor. Now, as far as the microbe involved, 80% of the time, it's E. coli. UTIs are 5 times more common in women than men, and that has to do with the location of where your urethra is to the anal area. And so as far as anatomy goes, you have the two kidneys right here, which connect to these two little tubes right here. They're called ureters. And these tubes drain down into the bladder. And then you have an additional tube called the urethra. When you have a urinary tract infection, you can have an infection here, 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 or right in there. But the E. coli tend to want to survive. So they're going to form biofilms in the bladder, which is going to make it very difficult to attack because now they go underneath the radar. And this is why a lot of people, especially women, get reoccurrent UTIs over and over and over, especially the more antibiotics they take, because these microbes now become resistant, which basically means they morph and they get smarter and they're harder to kill, and these antibiotics don't work anymore. So the more antibiotics you take, the worse things get. So this is why you're watching this video, to try something more natural. And one way to diagnose the UTI is a simple urine test, and you're looking for if there's high amounts of nitrates and leukocytes, which are white blood cells. There's also other tests that you can do to confirm it. Now, when people think UTI, they automatically go to cranberry juice and cranberry supplements. That's been somewhat effective, but not very effective because the cranberry tends to make the bacteria slide off and not stick to the inside of the bladder wall. So cranberry in general, I think, is good for a preventative thing. And I'm talking about maybe cranberry pills, not the juice, because there is some sugar in there. But typically, once you have a UTI, cranberry juice doesn't really work that well. Okay, so what I'm going to recommend is something that does work a lot better. It's a combination of oregano oil capsules as well as thyme capsules. Okay. Now, both of these are pretty potent herbal natural antibiotics, specifically with this natural chemical in both of these plants called carvacrol. And when you get the oregano, make sure it's at least 60% carvacrol. And I would recommend taking at least 200 milligrams, at least, it could be more, 4 times per day of oregano oil. And as far as thyme, try to find something that's 500 milligrams, and you can take that once a day. Because this chemical in both of these plants inhibits biofilms. It also kills E. coli, the major microbe that's involved in this infection. I'm also going to recommend taking apple cider vinegar, 2 tablespoons in 16 ounces of water, to drop your pH, to make your pH more acidic. If you're more acidic, there'll be less pathogenic microbes. The acid tends to inhibit the formation of these microbes. The other thing I'm going to recommend is to drink at least 2.5 liters of fluid a day. And of course, you can add that apple cider vinegar to this liquid, because the more fluid you have, you can actually assist in help flushing out these microbes as you're killing them with these 2 things right here. There's also an optional step I would recommend, okay? Taking some natural diuretic. That way you can help to increase the flow of urine through these channels through here. Asparagus is a really good natural diuretic. Dandelion greens is another good natural diuretic, or potassium citrate, as in a lot of electrolytes. Okay, so that will help flush things out very nicely. Now, since we're on the topic of natural antibiotics, okay, and oregano oil, there's some additional information I think you'd be very interested in. I put that up right here. Check it out.